Did you know that excessive use of medications in everyday life, such as those for headaches, can cause serious damage to your liver and potentially lead to death? I am sure you have taken some of these medications, and you might even have some in your home right now. Today, you are going to learn about the signs of liver damage that you need to watch out for, how to prevent such damage from occurring, and how to find out if the medications you have at home are harmful to your liver. Did you know that the liver is the largest solid organ in our body, vital for our survival and well-being? It diligently works to detoxify the blood, assist in digestion, and restore energy levels. These are functions we cannot live without. This crucial organ also plays a significant role in the metabolism of medications. Unfortunately, certain drugs can directly harm it, resulting in what is known as drug-induced liver injury. So what makes the liver particularly susceptible to damage from medications? As you eat, drink, and take medications or supplements, your liver is the unsung hero, tirelessly filtering these substances, storing nutrients, and eliminating waste. This constant processing significantly heightens the risk of encountering harmful agents. Numerous studies indicate that a variety of medications, including herbal medicines and dietary supplements, can increase the likelihood of liver damage. In today's video, we will discuss the 5 most popular medications that can harm your liver, what symptoms to look out for, and what you can do to prevent and safeguard your liver against these potential harms. Number 1. Tylenol. This widely used over-the-counter pain reliever and fever reducer contains acetaminophen, which is generally safe for the liver when used sporadically and within recommended doses. However, liver damage can occur with large doses or chronic use. Even a single excessive dose of Tylenol can result in liver damage, a condition known as Tylenol overdose. This constitutes a medical emergency, necessitating immediate action. If you suspect an overdose, it is critical to call a poison control center or go to the nearest emergency room without delay. Frequent use of Tylenol or taking it over an extended period can lead to liver damage. This risk is heightened in individuals with chronic illnesses, alcohol use disorders, or pre-existing liver conditions. For people over 60, this risk is even more significant because your liver function naturally declines with age. Your body becomes less efficient at processing medications. You can reduce the risk of Tylenol-related liver issues in the following ways. Never exceed the maximum recommended daily dosage, which is 4,000 milligrams. Avoid drinking alcohol while taking Tylenol. Always check whether acetaminophen is an ingredient in other medications you are taking, including both over-the-counter and prescription pain relievers, to avoid unintentional multiple dosages. Be aware that many common cold and flu remedies also contain Tylenol or acetaminophen. Acetaminophen is known to potentially harm the liver by producing a toxic byproduct during its metabolism. This metabolite can build up over time, leading to structural changes in the liver and impairing its normal function. Drug-induced hepatitis is a condition where the liver becomes inflamed due to the effects of certain medications, often as a result of excessive or inappropriate use. Medications known to be harsh on the liver, such as acetaminophen or nimesulide, can significantly increase the risk of developing acute or even fulminant hepatitis. Number 2. Diclofenac. Diclofenac, sold under brand names like Cataflam, is an anti-inflammatory medication frequently used to alleviate pain from various injuries and conditions, including arthritis. The concern primarily relates to oral ingestion rather than topical application. Topical applications, such as gels, creams, and patches, carry a lower risk of liver injury since the body absorbs significantly less of the drug compared to oral forms. Chronic daily use, particularly in individuals susceptible to liver issues, may heighten the risk of severe liver injury over time. Non-steroidal anti-inflammatory drugs, or NSAIDs, are commonly taken for pain, inflammation, and fever. Some are available over the counter, but others, such as oral Diclofenac, are available only by prescription. Diclofenac stands out among NSAIDs for its potential to cause liver injuries. Often, such damage may be enough to cause abnormalities in liver function tests without producing noticeable symptoms. Liver function tests assess the levels of liver enzymes, which are proteins, and elevated levels can signal liver injury. These tests are conducted through blood samples taken by healthcare professionals. Although serious liver damage from diclofenac is uncommon, the risk increases in women with higher dosages and with extended use, typically beyond 4 weeks. For people over 60, especially women, this medication requires careful monitoring. Number 3. Amoxicillin-clavulanate. Amoxicillin-clavulanate, commonly known as clavulin, is an antibiotic combination that many have used to combat bacterial infections, such as pneumonia, urinary tract infections, and sinusitis. Have you taken this medication before? If so, let us know in the comments. Surprisingly, following paracetamol, amoxicillin-clav is one of the leading medications associated with liver damage. The combination includes an antibiotic and a substance that inhibits bacterial resistance to the antibiotic. It is thought to cause liver damage through an allergic reaction within the body, though the precise mechanism remains unclear. Other drugs frequently linked to liver injury include antibiotics like isoniazid, trimethoprim sulfamethoxazole, erythromycin, nitrofurantoin, minocycline, and the antifungal medication ketoconazole. For older adults, antibiotic-related liver damage is a serious concern because infections become more common with age and the immune system becomes weaker. Number 4. Statins. Statins, including well-known varieties such as simvastatin, atorvastatin, Lipitor, and rosuvastatin, are among the most widely prescribed medications worldwide due to their effectiveness in managing high cholesterol. They do, however, carry a risk of liver injury. These medications are thought to cause liver damage by producing a toxic metabolite or provoking an allergic reaction, although the exact mechanism is unknown. Zocor, simvastatin, another statin, has also been associated with liver injury. Liver damage from these medications is usually mild and typically reversible after a patient stops taking the drug, with guidance from their healthcare provider, of course. In such cases, you can usually continue using the medication. However, if there is a severe increase, switching to a different statin might be necessary. Liver issues with statins are uncommon, but as a precaution, your healthcare team might conduct a liver enzyme test before you start the medication or soon after. Further testing is typically not required unless you experience liver-related symptoms, including unusual fatigue, weakness, loss of appetite, upper stomach pain, dark urine, or yellowing of your skin or eyes. It is important to contact your healthcare professional immediately if you experience any of these symptoms. For people over 60 on statins, regular monitoring is essential because your liver function may already be compromised by age or other conditions. Number 5. Amiodarone. This is a medication prescribed for managing irregular heartbeats. It is noted that elevated liver function tests may occur in up to half of the individuals on long-term amiodarone therapy. Although this elevation typically does not lead to severe health issues, there is a small percentage, about 1% of users, who may experience more significant liver damage. Due to this potential risk, the FDA has placed a boxed warning, which is their highest alert level, on the drug to inform both patients and healthcare providers of the serious risk it poses to liver health. It is important for those taking amiodarone to have regular monitoring of their liver function and to consult with their healthcare provider for any concerns or symptoms that may arise. Liver injury related to amiodarone is more common in people who take the medication at higher doses and for long periods of time. Thankfully, this risk can be monitored. You will likely have regular liver function tests while taking amiodarone to make sure your treatment does not need to be adjusted. Can supplements cause liver damage? Yes, supplements can potentially cause liver damage. In fact, studies indicate that supplements are responsible for up to 20% of liver injury cases in the United States. Dietary supplements that have been linked to liver damage include bodybuilding supplements that contain anabolic steroids, weight loss supplements with green tea extract, certain vitamins such as niacin, particularly when taken in high doses, up to 3,000 milligrams per day over several months, herbal products like ginseng and black cohosh, and other multi-ingredient nutritional products. It is important to approach the use of dietary supplements with caution and to consult healthcare professionals before starting any new regimen, especially those that might involve high doses or long-term use. Early signs of liver damage from medication: the liver, resilient to many forms of injury, can rapidly deteriorate and fail within days. Symptoms often start with nausea and vomiting, progressing to severe abdominal pain, and in extreme cases may result in a coma. Monitoring bodily symptoms is crucial to detect potential liver damage from medications. Early signs may include stomach pain, fever, diarrhea, dark urine, jaundice, which is the yellowing of the skin and eyes due to high bilirubin levels in the blood, nausea and vomiting, extreme fatigue or sleepiness, rash, and pale or white-colored stools. If you experience any of the symptoms mentioned, it is critical to seek medical attention immediately. Bringing the medication boxes you have used in the past weeks can be very helpful to healthcare professionals as it aids in identifying appropriate treatment. Liver damage is a serious condition that can escalate to life-threatening levels without timely intervention. Without prompt treatment, options may become drastically limited, often leading to the necessity of a liver transplant or, in the most severe cases, resulting in death. The liver's drug inactivation process is generally consistent across the population. Nevertheless, variations can occur. This explains why some individuals exhibit sensitivities or intolerances to certain medications. Their livers process drugs differently, leading to adverse reactions. Have you ever encountered someone who is sensitive to specific drugs? Their unique physiological response to medication metabolism is the underlying reason. Individuals can exhibit differences in how rapidly or slowly they inactivate drugs, and their livers may carry out various modifications. In some cases, this process can generate toxic molecules. For people over 60, these variations become even more pronounced because your liver enzymes change with age. Such variability significantly impacts the risk of drug-induced liver injury, underscoring the importance of close monitoring of liver function during treatment with certain medications. Moreover, some medications can prompt a severe immune reaction, leading to liver damage. Vigilance in observing any signs of liver injury is crucial, particularly when taking medications with a known potential to affect liver health. This discussion has highlighted 5 particular medications known to cause liver damage, but it is important to be aware that there are other drugs which might carry similar risks. To determine if the medications you are taking carry this risk, you should look for the section on adverse effects in the drug's leaflet. Do not panic if you see that there is a risk of hepatitis or other liver diseases listed. Always have an open dialogue with your healthcare provider about any medication-related concerns you have. Drug-induced liver injury, while serious, is relatively rare in the general population. Remember, your liver is your lifeline. Protect it by staying informed about the medications you take, monitoring your health, and maintaining regular communication with your healthcare provider. Thank you for watching.